As a physiotherapist with a special interest in osteoarthritis, I see a lot of patients with arthritis, and I'll often ask them, is it osteo or rheumatoid? And some of the time they're not quite sure because it hasn't been explained to them. So in today's video, we're going to go through exactly what the differences are between both conditions, because they're very different conditions, but keep watching until the very end because they're also managed very differently as well. Now, fundamentally, they are very different conditions. And although the more we learn about osteoarthritis, we do think there is a significant inflammatory component to the disease, which is similar to rheumatoid. Fundamentally, rheumatoid is an autoimmune condition. And this basically means that in people with rheumatoid arthritis, they have an issue with the immune system, and the immune system is attacking the affected joints. The onset of both conditions tends to be quite different as well. So in osteoarthritis, it tends to be insidious. It comes on gradually and slowly over a period of time, generally in people over 50 years old. However, the age has been decreased at the lower end to around 45. However, in rheumatoid, it tends to be very different. It's not a gradual slow onset, it's a rapid onset that comes on quickly, and it's in younger populations. So it tends to be between the ages of 30 and 50 that people first notice their symptoms. The presentation of the joints themselves are also quite different. So in rheumatoid arthritis, the joints are often quite red and hot and angry and swollen. Whereas in osteo, they can be swollen from time to time, but they're very rarely red and hot and angry. The other thing to say about the joint presentation is rheumatoid is a bilateral condition, so it tends to affect both sides. So if it's one hand, it's normally the other, both knees, both feet, both hips. Whereas in osteo, again, it can affect both sides, but it tends to be more unilateral, so one-sided. And if we take the hand specifically, both conditions also tend to affect slightly different joints as well. So in osteoarthritis, it's mainly the distal interphalangeal joint, the one at the very end, and the carpometacarpal joint, the joint at the base of the thumb that's affected. Whereas in rheumatoid, it's mainly the proximal, so the one in the middle, proximal interphalangeal joint, and the metacarpal phalangeal joint, so the knuckle itself that's affected. The pattern of pain also tends to be quite different in both conditions. So osteoarthritis tends to be a normal mechanical type of pain. So it gets better when you rest it, gets worse when you move it. Whereas in rheumatoid, it's the complete opposite. So it tends to get worse when you're at rest, and then when you're moving around, the pain tends to improve. Night pain is also a common feature of inflammatory type conditions like rheumatoid arthritis. So typically it tends to get worse in the latter part of the night, the second half of the night. And it's not like you can just roll over, get comfy and carry on sleeping, because there is a systemic problem. It's normally that you have to get up, you have to take a pain relief or an anti-inflammatory to try and get back to sleep, or you have to get up, move around, do a bit of exercise, do some stretches to get back to sleep. You can get a little bit of night pain in the latter stages of osteo, but it still tends to fit that mechanical type of pain where it's a bit sore in one position and you get comfy and you can go back to sleep again. Whilst we're on the subject of sleep, morning stiffness is a key factor for both issues, but again, quite different. So in osteoarthritis, we expect morning stiffness for less than 30 minutes. Whereas in rheumatoid arthritis, we expect morning stiffness for potentially up to or more than an hour. If you are watching this video because you do have osteoarthritis, then this is just a quick note to say I have recently put a completely free osteoarthritis ebook together for you, going through how you can manage your symptoms better at home without the need for injections and surgery. So if that does sound of interest, you can find a link to the ebook in the description below the video. So I hope that has cleared up any confusion, if there was any that you may have had about the differences between rheumatoid and osteoarthritis. If you do have any questions, then please do drop a comment below the video. I answer every single person's question that leaves one. And if you have enjoyed today's video, you found it helpful, there's lots of different videos on the Genuine Physio YouTube channel about arthritis and how to improve your symptoms at home. So do check those out. And until next time, I'll see you again very soon.